Hi everyone, in this video I'll give you a brief overview of cow's milk protein allergy. It is an immune-mediated response to casein and whey found in wheat, and it is very different to lactose intolerance. Cow's milk protein allergy is an immune response to those triggers, whereas in lactose intolerance, a person has the inability to digest lactose due to the low levels of the enzyme lactase, which breaks down that sugar. The patient with lactose intolerance is still able to consume dairy products that are lactose free, which is not the case in patients with cow's milk protein allergy. Cow's milk protein allergy is the most common childhood food allergy in the developed world, and it is most commonly diagnosed within the first year of life. It is seen in 7% of formula-fed babies, compared to only 0.5% of exclusively breastfed babies, which could suggest there is a protective factor of breastfeeding your baby against cow's milk protein allergy. And some of the main risk factors to be aware of are personal history of ATP as well as family history of ATP or cow's milk protein allergy. There are two main types of cow's milk protein allergy to be aware of. One that is IgE mediated and another one which is non-IgE mediated. The IgE mediated has an immediate response and therefore symptoms occur within 1 to 2 hours after ingesting milk. It is called CMPA, often abbreviated at least to CMPA, and it is a type 1 hypersensitivity reaction, which means that B cells are stimulated to produce IgE antibodies against cow's milk, and there are histamine and cytokines produced which cause the symptoms I'll be discussing later. Non-IgE mediated cow's milk protein allergy is obviously non-IgE mediated, and it is called CMPI, often abbreviated to CMPI, and it involves T cell activation against cow's milk protein, so there are no IgE antibodies produced against cow's milk. Clinical presentation is divided into gastrointestinal, respiratory, and dermatological symptoms. The main gastrointestinal symptoms to be aware of are vomiting and reflux, but you can also see stomach pain, diarrhea, and failure to thrive. Some of the key respiratory symptoms include wheezing and sore throat, but you can also suffer from earaches and persistent coughs. And dermatological symptoms include things like eczema, rashes, and hives, and in some more severe cases, swelling of eyelids and lips. A mnemonic you can use to remember those symptoms is CURD, with colicky symptoms such as reflux and vomiting, upset, rashes, and diarrhea. The main investigations to look out for are just general clinical signs and history, an IgE antibody test, and patch testing. The clinical signs show improvement with elimination of cow's milk protein from the diet, and normally stopping cow's milk for 2 weeks should improve the symptoms in the patient. IgE antibody can be used to test for IgE-mediated cow's milk protein allergy, and you can also possibly do a patch test to look for an allergic response. It is important to note that non-IgE-mediated allergy cannot be diagnosed using tests, and it is a diagnosis of exclusion, so you have to take out possible triggers and allergens to see whether the patient improves. The management splits into two categories of formula-fed children, where you would use an extensively hydrolyzed formula first line, or an amino acid formula in case this hydrolyzed formula has not worked. For breastfed children, you would do an elimination diet for 6 months, and that would include the child and the mother, due to the risk of the milk products transferring into the breast milk and therefore entering the baby. And it is important to know that soya-based formulas are not recommended in infants who are less than 6 months old due to the weak estrogenic effects of isoflavones which are found in soya-based milks. The key complications to be aware of are malabsorption and faltering growth, iron deficiency anemia, and in very severe cases, anaphylaxis. This was a very brief overview of the condition. If you have any questions, please leave them down in the comments. But other than that, thank you so much for watching.